we hear the term ADHD a lot, and it has almost become this all-encompassing label that doesn't actually mean anything anymore. So, can you tell us what the actual definition of ADHD is?
No, I was smiling because I could not agree more with that last sentence. Because I think this is where some of the parent, I don't say outrage, but where some of the interest comes from, and that two things can be true at the same time. Is ADHD misunderstood and maybe overdiagnosed or overused as a rationale? That is true, and it's also a real condition. Both of those coexist, and I do agree with the misinformation part too. So at its core, because sometimes you'll hear the old, they have ADD, not ADHD. Well, around the year 2000, those terms were combined, and essentially you're looking at a condition where you can have hyperactivity. So how it will show up is it's the kid who's always on the go. They can't sit still. They're in conversations. They're blurting out answers before you finish asking a question. They're interrupting other people. Getting feedback from teachers that they're always talking and moving around the class. They can't sit still. You can also have the inattentive side where if you're watching the kid, you may not realize there's anything going on, but it's the kid that zones out, for lack of a clinical way of saying it. They lose things all the time. So it's the kid you're trying to get ready to go to a soccer game, and they can't find their cleats, or they can't find their shin guard, or in adults it's they can't find their phone, they can't find their wallet, they can't find their keys, they lock themselves out of their car. They struggle with a lot of times reading comprehension, so they'll read the same thing 3 or 4 times and they still can't tell you what they just read. And you can also have the impulsivity side where essentially it's exactly what the word sounds like. They do things very impulsively without thinking about consequences, lots of risk taking behavior, or just doing silly things without fully. It's like they're acting before they can think about it, essentially. With those three kind of overarching symptoms, the disorder can look different kid to kid. You can have the child who is strictly hyperactive. You can have the child who's strictly inattentive or impulsive, and you can have the combined type where essentially it's like a menu. They have signs of all three of them. And I will say too, as far as diagnostics go, this is a childhood disorder. It's a neuro biological condition. Symptoms have to be present in childhood for it to be diagnosed. You can't grow ADHD when you're 25, for example, or maybe 18 or 19 in the case of a college athlete.
Well, you just described my childhood, so there's that.
Well, it's full
Grow,
disclosure. I was same here. So
yeah, like I was. I mean, I was the talks too much kid growing up in like elementary school, middle school. My friends hated me in college because I mean this was right when I went to school from '04 to '08. Grad school was '08 to 10. So like laptops were just getting in class, and like my friends would hate me because it would look like I'm not paying attention at all in class. Then I could raise my hand, ask one question that was totally pointed to what the professor was talking about. And the professor would never question if I was paying attention or tell me to get off my computer because it's just, that was a gift of mine that looking back was a little bit of the ADHD probably.
and I know we're going to get to the gift side of it, but I definitely want to come back to what you just said there. It's so accurate.
And I, without going too deep, another term that people are hearing more and more about is ADHD. Can you give us
Hmm.
a high picture of what that is?
Absolutely. Essentially, and the research is still mixed on this. So again, save the hate comments here. Um, and I'm not saying it's not a real thing or it is a real thing. Currently, not recognized by the American Psychiatric Association, but research is ongoing. But essentially, it is a combination of the autism spectrum and ADHD together. There is some emerging research that's making the argument that perhaps ADHD is on that spectrum along with other typically described as autistic conditions. Um, and again, there's some pretty compelling stuff coming out that potentially those two are linked in some ways. And I think there is an overlap to some degree anyway of symptoms. For example, some social impairment. I think both groups are going to have some form of social. Like, again, like you just said, your friends in college hated you for whatever reason, but or the teachers are upset because you're talking too much or you're not focused in class. Well, if a child's struggling with some autistic social skills, they're also going to have some deficits in that direction, as an example. But essentially, that is the where the research is looking at is there truly a connection between the two? I think there absolutely can be, but more to come on that one.